Welcome back. For some, the pandemic might be something you want to forget ever happened, but for Indiana Attorney General Todd Rokita, it's still top of mind more than 4 years later. But why? 21 Alive's John Wagner is in conversation with Whitney Downard at the Indiana Capital Chronicle tonight.
We're talking about your article right now on IndianaCapitalChronicle.com about Attorney General Todd Rokita and this 29-page document that he has released that really alleges that the state of Indiana has overinflated the number of COVID-19 cases, especially mortalities, things like that. What's in those compiled pages?
Yeah, so I do want to preface this by noting that, as far as I know, nobody on Todd Rokita's staff has a statistician or data science background. There is not really anybody named as a contributing person on the report, so that's a little confusing. You know, traditionally, when we look at extensive reports like this, there are pages and pages of people who contributed, studied, analyzed, researched. But all he says is that it was an internal study of his staff, which means it was a bunch of lawyers who were reviewing death records. It appears to be the majority of what this analysis consists of. He claims that some deaths were falsely attributed to COVID-19, but again, he does that based on where COVID-19 is displayed on the death record, while also admitting that he doesn't know if that was a death specifically counted as a COVID-19 death because he doesn't have the health records associated with how the health department counted those deaths.
And that's because the Attorney General's office only has access to certain parts of the information, is that right?
Yes, so the Indiana Department of Health purposefully keeps data that's in its publicly facing websites pretty anonymized, so that way, you know, you or I cannot identify how Jane Doe died in Grant County, that sort of thing. But we can kind of get more broad sweeps and trends of how things went. And that appears to be the sort of data that he was using, and that he was comparing that to the number of death records he saw. And it's not really clear how his methodology went forward on that. But that is where he came up with the death discrepancies he identified. And then he also accused the Department of Health of inflating positivity rates, which for a while were used to institute lockdowns or limitations on gathering sizes, et cetera, in counties across Indiana.
Yeah, and you know, inside your report, Governor Eric Holcomb has also seemingly made his feelings about this pretty clear. You guys got reaction from him. He says this report, he has very little thoughts on this report. He stands by accurate Department of Health reporting numbers. Governor Holcomb says those numbers are accurate. He can't speak to where Attorney General Rokita got his information, and that he certainly didn't work with the Department of Health or with our office, the governor's office. What was Governor Holcomb's sort of overall tone when he got reaction on what Todd Rokita released?
Yeah, so when we asked the follow-up question about how much validity he thought the report had, he was very brief and just said 0. And actually, this report kind of seems to be a bit of a prolonged clapback to a spat the two had back in 2021 when Rokita publicly questioned the calculations used for positivity rates. And Governor Holcomb said something to the effect of, it's irresponsible for a high-ranking politician like this to be sowing disinformation. Of course, I'm paraphrasing there. And so Rokita, and actually at this rally, I should mention, it was not a press conference, it was a political rally where he announced this document. Rokita's introduction, the local South Bend politician introducing him, actually said this report was designed to back up what he had said on TV in 2021.
And so you've covered the governor's race quite a bit. We have somebody who's going to be Indiana's new governor. Is anybody saying anything relevant, anything related to the pandemic, on how it's been handled in the past, how they might handle, you know, a massive public health crisis like this in the future?
Yeah, so there's been some pretty consistent talk about never going back and government overreach. And actually, I should note that following General Assembly action, emergency powers like the one that Holcomb took during the pandemic will be curtailed. And Holcomb actually signed that legislation. So I think that he probably agrees with how that was handled as well, which would limit him to a 60-day declaration statewide, as opposed to the unending declarations he exercised during the COVID-19 pandemic, which allowed us to get some sorts of federal funding in many arenas.
Well, for now, fingers crossed, neither of us have to cover anything like the COVID-19 pandemic for the rest of our careers or, our kids' careers. Whitney Downard at the Indiana Capital Chronicle, thank you so much for taking some time for us this afternoon.
Thank you. Appreciate it.